To one more session of a YouTube Live and Instagram Live both. So everybody join in so that I'll discuss a case first, an interesting case, and then we'll discuss something about some question answers which I'll take from the doctors. So welcome Dr. Palak, Dr. Anjay. There was a very interesting case maybe recently, about a week back he came, and there was a very Dr. Avish, welcome. There was a very interesting symptom which the patient suffered. So the patient had just see the symptoms. What I'm telling you, the patient said, "Gale mein bahut dukh raha tha." The throat feels very raw and coughing. There is pain in the throat, and when I saw the mouth, it was reddish inside. And he said there was some pressure feeling in the throat. So these were the symptoms. With these symptoms, which remedy comes to our mind? That is important. Then I will tell you what did I prescribe to the patient. Simple case: the patient came with a lot of pain in the throat. Throat feels very raw, and there was, when I opened the mouth, the fauces appearing very red, deep red, and there was pain on swallowing. Simple case, simple symptom, but very important. Which remedy comes to your mind? That is important. And I think it was within about 1 day or two only, the patient got relief from the complaints. As I always say in homeopathy, the understanding of symptom, the interpreting of symptom basically will decide your result. You may have a lot of wonderful case takings, a lot of hours of case taking, but if you cannot interpret that symptom properly, you will never be able to understand. Yes, so Dr. One says we have Vithya, we have Phytoleka, and we have Belladonna. Okay. And Dr. Meera, good afternoon. Dr. Karthik, yeah. So most of you say Vithya. Dr. Jain, Vithya. Okay. Any other thing which comes to your mind? Good afternoon, Dr. Karthik. I hope YouTube doctors are able to see, because I'm not able to see anybody on. There are a lot of audience, but I cannot see them. Are the YouTube audience able to hear me properly? Yes or no? YouTube audience, good afternoon, Dr. Karthik. So, which remedy comes to your mind? We have three. Yeah, okay. So I'll answer the question, Dr. Zwayar. Yes. So yes, hello. Yeah, we can hear. So this remedy, which remedy comes? One is Belladonna, one is Phytoleka, and one is Vithya. These are very, very common, and they will definitely come to your mind. Okay, we have Muxol also. See, now in homeopathy, what happens? There are some remedies which are so very, very frequently used, and definitely we get results also. But it is very important to know that you have to go a bit further. And then I asked the patient anything else, and he said, "Yeah, when there is cough, there is metallic taste in my mouth." With all these symptoms, the rawness of the throat, the redness of the throat, the difficulty in swallowing, he added one symptom, that there is metallic taste in the mouth when he coughs. Now this again becomes see how the symptom progresses. Be very patient and then try to give the remedy rather than just prescribing. Most of us, including me, first thought of Belladonna, then Muxol, then Phytoleka, Hepar. And now we have one more remedy. Dr. Meera says nitric acid. Any other remedies that comes to your mind? Yes, let me finish, Dr. Pandey, then I'll answer questions. This was a very, very interesting case. Any other guesses, or I'll give the remedy to you. I think you should all give one try to the symptom. So we have nitric acid, we have Belladonna, we have, hello Dr. Babal, we have nitric acid, Belladonna, Muxol, Vithya. Anything else comes to your mind? Now see the symptoms. Throat feels very raw, hoarseness of throat, pain in swallowing, deep redness of the fauces, and metallic taste while coughing. And I prescribed the patient a single dose of bromium. Bromium. If you look at bromium cough, you'll be surprised. It has all the symptoms so very close to these remedy which you have told. Phytoleka, Muxol, Belladonna, nitric, everything is there. But metallic taste on coughing, if you see, that is bromium. And bromium has one more symptom. There is a lot of hoarseness and difficult and painful breathing. Calibachrome, yes, calibachrome is very important when the discharges are there. But we are talking about rawness now. So this is a very important thing in homeopathy, my dear friends, that just be patient and wait till the last. If you wait till the last, the patient will tell you that symptom which is the most important symptom in that case. If you open bromium will have seen all the symptom in one symptom, bro. It is written difficult and painful breathing. That is a very, very important symptom of bromium. And every inspiration provokes cough. This is not the patient comes and tells, Doctor Both, I have a lot of cough, and the cough is there. So whenever he's inspiring, he starts getting cough. And that is again a very, very important symptom of bromium, which I have seen, and clinically lot of patients are verified in my practice. So my dear friends, make this very, very clear in your mind. Good case taking can be done. Good interpretation will give you the remedy. So this is for you, bromium. Just I prescribe bromium 30 single dose, and 24 hours the patient was absolutely fine. So metallic taste during coughing. Second, pain in the throat while swallowing, hoarseness of throat, redness of throat. These are symptoms in relation to bromium. So I hope you go home and read bromium. And if you have any questions on bromium, I can answer, but there are a lot of questions which I'll first take. Welcome, Dr. Tony, Dr. Joshi. 50 years man has marjuna addiction. He abuses and throws house things. Please help. No, see, if you have marjuna addiction, definitely when you're in that intoxicated state of marjuna, you will definitely be out of control. So first of all, you have to understand in this case, Dr. Pandey, why did he have the habit of marjuna? What was the cause? And then if you see on the cause and then be able to prescribe, you will get the remedy. And it is important because normally addictions are because of some mental trauma, because of some wrong surroundings, wrong people. So ask why and then proceed in the case. Otherwise, you will be only prescribing on the toxic symptoms of marjuna and not the symptoms of the patient. We have to prescribe on the symptoms of the patient. So when the effect of marjuna is not there on the patient, take that symptom for prescription, and you'll be able to handle this case very well. Yeah, Dr. Komal, welcome. Dr. Abhishek, welcome. Dr. Smith, Dr. Babal. A male aged 19 years, painless, hard membrane bumps on scalp with little pus inside which don't itch, is not present anymore, and reddish found. What will be the remedy? See, whenever you get cases where there is a lot of itching in the scalp, and eruptions in the scalp, there are lots of remedies. Okay, first of all, important symptom is there. Whenever the eruptions in the scalp, you have to think about remedies. Now you have written basically whether a lot of boils, there is a lot of bleeding, the pus discharge is there. Of course, in scalp, the infection rate is very high because of the sebum that is secreted. So you have described it maybe somewhat related to eczema of scalp. Now, if you see the symptoms, whether there are boils, there are eczema on the scalp, there are few remedies very, very commonly used. Ask about the discharges. Think about miserinum, think about sulfur, think about rustox, think about sorinum, and think about nitric acid. These are very, very important remedies. Of course, then please do think that if the patient is hot or chilly, whatever I can repetize, if the patient is chilly, then the remedies will become miserinum, which is chilly, rustox, which is chilly, hiparsul, which is chilly, and silicia, which is chilly. So chilly remedies are there. If your patient is hot, if the thermal of the patient is hot, then the remedy would change. The remedy would be at that time calcarea sulf, it would be lycopodium, sulfur, and you can think of kali sulf also in relation to one of the salt of sulfur. So in this way, you have to differentiate with thermals and add, because there will be a lot of remedies which have these type of symptom, Dr. Zayar. I hope I am pronounced it properly. Dr. Mira, yeah. One for elevated uric acid leaves in teenagers. Venkat, welcome. So, injured knee causes pain during ascending stairs. Please help. Injured knee. Whenever you have injured knee, basically, see, whenever you have injured knee, you have to first see whether the injury is so grave or not. Whenever you have injured knee, normally injured because of trauma, injured because of after operation, or whatever the cause is, make sure that is there. Otherwise, injured knee ascending, as there are a lot of remedies where there is that pain is aggravated by ascending. Definitely, because when you ascend, there is more pressure on the knee. So that would be a very common symptom in case if the knee is injured. So in this case, if you have to have the injury remedy, then you have those remedies like arnica, ruta, belispar and all. Because after injury, the ascending is a problem because there is pressure on the knee. So don't take that symptom of ascending because the knee is already injured. Okay. Injured knee cause. Okay. Hello, sir. I have proteinuria. Please suggest medicine. Yeah, Dr. Amit, proteinuria basically, I would say it's a condition where the kidney is not able to filter the protein and is going out. So in this case, don't take any shortcuts. It is very important to take the history, take a good case, and then prescribe the remedy rather than just one symptom of proteinuria. Don't prescribe on that. 25 years old man having uric acid level, what will be the cause? What should I give? Yeah, Dr. Mira, 25 years old man. Basically, what happens in these type of cases, what happens? Protein is very important. That's why uric acid goes high. So you have to prescribe the remedies, which are very, very common, which are there in our mathematica. First is colchicum, then comes benzoic acid, then comes lycopodium, then comes urtica urens, and then comes sulfur. So these are very, very common remedies which you should think about. So please tell how to approach in case of status dermatitis. Now, status dermatitis, if there is a status dermatitis, make sure. See, in homeopathy, there has to be a cause. There has to be some mental cause where the patient lands up to this. Because if you name the word dermatitis, then we have all the remedies, right from what you call sulfur to graphitis to hippursulf to lycopodium to rust ox to soranum sulfur, lot of remedies. But you should understand now dermatitis, what are the defining symptom of the dermat? Are there any local symptoms which are very, very important or remarking in the patient? Ask the patient how the thermals are. Ask the patient about the life situation, and then it would be much better to prescribe on dermatitis. Otherwise, these are the common remedies that you should think about in dermatitis. The patient is neither hot nor chilly. Okay, if the patient is neither hot nor chilly, then you have to take the case and then prescribe. I have told you a lot of remedies where you can think about. Oily scalp after exercise. Oily scalp after exercise, basically, there are patients whose sebum secretion is more after exercise. It's a basic what you call constitutional condition. If it is causing a problem, then constitutional prescribing is very important. Okay, so it is either hot or chilly, then you have to think something else, of Dr. Zaniwar. I have told you the remedies: hippursulf, mesarinum, rust ox, sulfur, calcareous sulf, kali sulf, all are remedies. Arsenic is there. Then depending on the pus discharge, when is itching more in the morning, evening, night, how is the pus, are there any scab formation? The scabs are removed very easily, or the scabs are removed very difficultly. These are other symptoms you have to look in this case of scalp eczema. Causeless anxiety, constant of any serious disease, easily frightened because in family one mother died because of cancer. See, whenever the patient has continuous anxiety, whenever the patient has a lot of anticipation, whenever there's a impatient in the patients in the patient, the most important thing to understand that the patient's internal economy is never at rest. It's always on the edge. And when you're living on the edge, you definitely are bound to attract a lot of disease, a lot of the susceptibility is low, so you'll be susceptible to more infections and more disease process, and you're susceptible to slightest emotional trauma also. So whenever it is there, you have to think and go with the constitutional prescribing, because that will make a harmony in the body, that will settle the mind, that will settle the susceptibility, and automatically the patient is able to fight the external environment or trauma, whatever is there. Dr. Moel Goyal, yeah, welcome. Dr. Rajula, welcome. Dr. Renu, good afternoon. Burning in urine, bleeding in the last part of urine, no UTI, diagnosed as prostatic hyperplasia, 23 years old male. Yeah, this is a very, very important symptom. First of all, if there is bleeding in the urine and there is no cause, then it's an alarming size, because these are conditions where you have to look into what is causing. Now, whenever if you see that there's bleeding, the urine is bloody, it is very important to understand, because if the patient is only 23 years old. So in this case, make sure that you have to take the whole history, because if I tell you some remedies, you try those remedies, and you will not get result. Opium is there, stamonium is there, the remedies are there, but it has to be very well taken. Otherwise, what will happen? You will only be treating that bleeding part, that will get better, something else will go, the disease will go inside, because there is no symptom and there is no what you call symptom, means there is no other cause, and the patient is just passing urine blood and there is no sensation. So this becomes an important symptom. Why? Otherwise, we'll be basically going in suppression. But if you have asked me a question, bleeding urination, there is no symptom, it is very chronic. Think about erigeron and lycopodium. These are very, very important remedy, and this will help you maybe to get entry into the case. Sometimes the patient says, as you say, the last part, at the end of urination, there is bleeding. So whenever there's a patient complaint of when there is bleeding at the end of urination, there are three remedies which I have found very, very useful in my practice. First is Hipar Sulf and not Sarsaparilla. First, I would rate Hipar Sulf first. Second is Sarsaparilla. And third, you'll be surprised, it is Pulsatilla. When this bleeding at the end of the urination, this is very important. I hope you got the symptom, Dr. Sachdeva. This is how you have to take the case. Welcome, Dr. Raki, Dr. Jyoti, Dr. Stubborn dry cough in 40 years, asthmatic, please help. Just a minute, Dr. Amulya sir, is there any remedy for strength of root of teeth and also for pain of root of teeth? See, whenever you are whenever basically you want to give strength to the patient, to the teeth, to this, the first and the most important thing, that means the whole constitution has to come up, So that is very important. There are some remedies which are very, very useful when there's pain in the root of the teeth. You can write down like Muxol is there, phosphorus is there, zincum, silicia is there, Hipasulf is there. But if you want to strengthen is a word where you have to take a constitutional symptom of the patient in order to prescribe. For roots only, if you want that local symptoms are important and you want to prescribe on that symptom, think about Muxol, think about phosphorus, think about silicia, and think about Hipasulf. Dr. Welcome, Dr. Nur Sagri. I hope I'm prescribing it properly. Next question is that stubborn cough. See, whenever the cough is stubborn, it basically 40 years personality, stubborn cough. Now, first of all, you have to understand what is the meaning of stubborn cough, whether the cough is become very chronic or whether the cough is since long. So if there is a chronic cough, not going, so you have to think about few remedies which are very, very important for chronic cough, which heals late. That is, phosphorus is there, nitric acid is there, Drosera is there, and of course, sponge is also there. So these are remedies for chronic cough which do not get relief with the symptom. It is written, chronic cough, stubborn coughs. These 4-5 remedies are very important. What is your opinion about LM potency? Yeah, LM potency I have told you before also, and I have taken in LM potency the whole session in Hahnemann Jayanti, So during I think last YouTube, so you can go. I have taken 2 hours for LM potency. So my opinion of LM potency I have already put on the YouTube video. So you can go home and see that YouTube video or the Facebook live. You'll get everything about LM potency in there. Still, if you feel, maybe I'll discuss sometimes in the next YouTube, but it's a very long thing. So we'll require a different class for that. You can go and see the YouTube video or the Facebook live. I have done in the Hahnemann Jayantis, I think. Root of teeth become loose, painful. Okay. So now we are still there, means if the root of teeth, okay. If the root of teeth are very painful, I have told you the remedies. These remedies are very, very important in your, if you have seen. If you open your mathematic also, the pain at the root of teeth, that remedy which I have told you are there in that also, Like root of teeth, you have to see the Muxol is there. Sometimes in the root of teeth, there are abscess formations. Think about silicia, think about Hipasulf. Sometimes there's a pain at root of teeth extending to the tips. Then the remedy becomes natrum carb. Now, simple, if the pain, the quality of pain, patient बोलता है कि मुझे ऐसे root of teeth में झटके मारते हैं, jerking pain in the root, then the remedy changes. Then it becomes lachesis and belladonna. Sometimes the patient comes and tells you, I feel as if something is pricking at my root. ऐसे सूच हुए समन लगता है. Then the remedy changes. It becomes mercor. Sometimes the patient says that it is so much pain as if the roots have been, the gums are tearing from the root. And in that tearing pain in the roots, the remedy becomes Muxol, Teucrium, Maram, Verum, and then you can also have lachesis. So it depends on the pain, and sometimes the patient comes and tells you, root पे इतना pain होता है, ऐसे लगता है वहाँ पे छाला आ गया, ulcerative pain at the root of teeth. Then also the remedy becomes alumina, silicia, and Muxol. Then the patient comes and tell you, I touch my root, no, it is very painful. So painful from touch also, manganum and silicia. So these are a lot of conditions, a simple pain in the root of teeth would be a very grand remedy, a lot of remedies. But then I will always tell it, define the symptoms which are present in the patient. Define the type of pain, tearing pain, ulcerative pain, and the patient will tell you. There are a lot of pains, but these pains basically I've seen in my practice, that's what I'm telling you. So if you are able to classify that type of pain, and if the pain is extending and all, you'll be able to prescribe better remedies. Okay. Send a request to be in your YouTube live. Okay. Yeah, Dr. Pandey, thank you. And I hope whenever you get some results, I basically want you should express in the YouTube so we all learn from there. Dr. Mithali, welcome. I hope I was not fast because there were a lot of questions. That's why I was a bit fast. I hope Dr. Sachdev, you got that about that burning, bleeding in the last part of urination. See, bleeding in the last part of urination, make sure that you prescribe the remedies with some differentiation. You have to have some differentiation, and you'll be able to crack the case very well. As I always tell you, bleeding, that last part of urination is such an important symptom, and then if I am able to get, okay, you have already asked a question, persistent cough on rising after sleep or morning is rattling but not comes out. So whenever the patient, see, this is a very, very important symptom where the cough is there from rising. Now, see, whenever you get this symptom, there are 3-4 remedies doctor says. They were very, very important. Do write down. First is coccus cacti. Second is lachesis. Third is sanguinaria. Fourth is Ehrlichia racemosa. And fifth is calibacrum. Very, very important remedies. Cough on waking. Coccus cacti, lachesis, Ehrlichia racemosa, sanguinaria, and calibacrum. These 5 remedies have given me a lot of results in my practice. So you also, of course, then definitely differentiate. Coccus cacti cough is a bit different than lachesis or sanguinaria or calibacrum. Slight differentiation, and you should be able to prescribe the remedy very well. Thank you, Dr. Amulya. Also, bleeding and pus from gums. Very, very important, no? Acha, you are taking Dr. Zain. Just a minute. A female patient ages 75 has chronic constipation. Former fungus in right ear but now subsided. Now itching in right ear, and after itching violent pain. Feels as if खाना चुभता है, stomach में जरा है. Stomach में जरा है. Okay. Also bleeding and pus from the gums. Now see, if you have what you call cases where you have written some symptoms in relation to bleeding gums and then constipation and all, it's a good thing. But now in this, the modalities again are very important. If you have a case where there is bleeding from the gums, some symptoms are very, very important. And some symptoms, like for instance, if you see that how is the bleeding? Bleeding is very easy, or whenever it's chewing there is bleeding, or in bleeding the how the taste of the mouth, how is the blood? It is watery, it is bloody. That is important. And then you have to have the symptom of constipation. Again, if you have seen constipation, there will be so many remedies in constipation. But now you have to see bleeding in gums with constipation. Some remedies very, very important. Think about calcarea carb, think about phosphorus, think about Naxomica, nitric acid, Hememalis, and add one more remedy, Hekla lava. But these are very generalized remedy, with constipation and bleeding gums. Do ask about the bleeding. How is the bleeding on touch, aggravation, amelioration, and then you will be able to prescribe and get to that similimum. Yeah, just there was a break. So I hope you understood, Dr. Zaiva, how to study and memorize concomitant. No, see, basically what happens studying and don't try to, what you call, I say, memorize symptoms and especially concomitants and all, just look at the remedy. As I always tell you, just look at the remedy, keep reading the remedy, and sometimes feel that I have read this remedy XYZ, Nectamur, Lycopodium, Rustox, Lacasis so many times, so I don't need to read it now. That's a very wrong concept. When you keep reading the remedy day in and day out, day in and polycystic remedies, because they are proved at length, you every time get some new concept, some new answers what is written in that remedy. So I will always tell you, just keep reading the polycystic remedy again and again, and Of course, the rare remedies which are there, you should always see also, because it's always better to have some rare remedies knowledge also. But polycrest remedy knowledge basically are very, very important, because it has improves in such a length, and every tissue of the body, every system of the body is affected. And if you have seen my YouTube live, I've taken some skin remedies, like a lot of skin remedies, where you never think about that this symptom is present in that remedy, because we have not read that skin symptoms of some remedies, because we have some prejudiced notions about some remedies, and we only prescribe on those symptoms. So I would tell you, just go on reading those polycrest remedies and add to your knowledge of some rare remedies, so that you are basically well versed with the polycrest also and rare remedies also. Okay, that's what I can say. Uh, what other remedies have affinity with bile duct? Patient 50 years, woman, history of depression, recently liver cancer. I was going to give natrum mur, but want to add support for gallbladder. Liver to help with the bile duct, chilidonium. Yeah, basically, if you see chilidonium, it covers, what do you say? It's basically like we say, no, CPI has all the symptom in relation to menstrual disorder. Like in this way, chilodinium basically, if you see, has all the complaints, all the symptom in relation to liver. You can always have chilodonium in your mathematical list. But just add one or two remedies which I have found very, very useful, because bile duct affinity, bile duct affinity, the remedy you should think about is Cardus mar, Cardus marinus. Cardus marinus, Cardus marinus, Cardus marinus. First, chilodinium is definitely there. Second, you must also look at a remedy which is again very, very important, and that is Hydrastis canadensis, golden seal. So these two remedies, like, very, very important, and add to your mathematical list. And there are some differentiation which you should be able to differentiate. Like, for instance, if I tell you Cardus mar, now Cardus mar, if you go and see, it's a very, very specific remedy, cardusmar in relation to bile duct and all, and a lot of doctors use those cardusmar for gallstones and all, and it's a fantastic remedy. But then if you are a homeopath which basically wants to differentiate the remedies and all, in that case, there are some symptoms in cardusmar. Maybe must have told you before, but aversion to salt meat, a very, very important remedy. And if you see Boric Mathematica, the Boric has written gallstone disease with enlarged liver. So it covers that bile duct, gallstones, and liver, all the three. And to prescribe cardosmar, he has written there is stitches in the left side of stomach near the spleen, like Sionanthus. And of course, there is pain in the region of liver, especially the left lobe of liver is very sensitive. Okay, and cirrhosis is there, dropsy is there, and the stools is bright yellow in color also. These are cardusmar. So do think about cardusmar also with chilodonium and Hydrastis canadensis. I could just tell you some symptoms of cardusmar, because it's a very, very important remedy. Yeah, Dr. Al-Magiras, Walaikum Assalam. Yes. So Dr. Sumita, I hope you understood about the cough part, waking cough. Very, very important symptom, because there are a lot of symptoms the patient comes and tells you, and if you wait for something, the patient tells you some beautiful symptoms, some very, very interesting symptoms, and you get the remedy very fast. Okay, so how long is the case taking? It does not matter. What you have interpreted from the case taking, that is more important. The aura. I always say the aura of the patient is very, very important. You have to feel the patient. If you feel the patient, as you feel something, I feel that this patient is this. When you feel the aura, as Dr. Kent says, then you will be able to prescribe it very nicely. The simillimum comes very nicely. So some questions have scrolled up on YouTube. I think there were a lot of questions which I could not answer. The same here in Instagram, there were a lot of questions. I hope Dr. Vansh understood something about Mathematical. I have taken a lot of Mathematical classes. If you could have joined one of the two classes, you would have got an idea how I teach Mathematical and how Mathematical has to be understood. It is not only that symptoms you have to understand. It's something which is more how does the remedy behave, and how does the remedy react to a situation. That is very, very important to understand. So maybe sometimes if you get time, just watch for the mathematical classes, Dr. Vanshi. Yeah, I hope. Yes, any other questions? If I have not answered, do write on the YouTube or Insta because it must have scrolled up. Otherwise, I could have Mathematica going on and going on. Vertigo, sudden paroxysm, male reeling, walking aggravation. Yes. Whenever the word vertigo comes, it's a very, very, what you call, disease where it is difficult to cure, I must say. But see, whenever you get a case where the patient comes and tells you sudden vertigo, I would add few cases where who responded very well to what you call chinopodium, chinopodium, and of course, in relation to worm, if chinopodium is there, it is very nice. But as you have added two symptoms, that sudden vertigo and what you call, what you have written, walking aggravation. Now, if you it's a very good that you have now at least tried to get some symptoms that I will be able to prescribe. If you can get the thermals also, chinopodium, that was sudden vertigo. Normally for sudden vertigo, if there is no other cause, I basically think about argentum metallicum, chinopodium, and bovista. But you have written sudden vertigo and walking while aggravation. So 3-4 remedies, very, very important. First remedy, you'll be surprised, and that is arsenic album, stramonium, sepia, camphor. One remedy which I have been using, it comes in rare remedies because it has lately proved, that is ozone. Ozone also has a very important symptom, sudden vertigo and walking while aggravates. So you can add one more remedy, that is arsenic bryonia, stramonium, camphor, ozone. Have given me good results. Of course, that's what I can think from my what you call store of Mathematica. Recurrent cough and cold with enlarged adenoids. High recurrent cough and cold with enlarged adenoids, Dr. Sachdev, I think adenoids we have taken but still there is calcarea fluor, there is tucrum verum, there is phosphorus, there is tuberculinum, there is sanguinura nitricum, and lemna minor, calcarea iode, agraphus nut. High OTPT in the 8th month of pregnancy before the first pregnancy. Also, I am giving Childonium 30, it was better before, but now all of a sudden it has increased. Now, Childonium 30, basically, as I tell you, it's a specific for liver, but not in all cases you will get the result. Now, it is the first pregnancy and the OTPT are high. So, do ask any other symptoms? Whenever the word pregnancy comes, it is very important to understand that any other symptoms. Because in this case, you can think about Nux omega. In this case, you can think about pulsatile also. Okay. Arsenic, there is a lot of health anxiety plus cancer fear, but not better. Okay. So maybe arsenic has not worked. So you can think about, as I told you, some remedies. Bryonia is there, sepia is there. In fact, if you have prescribed arsenic, there is one more remedy, that is China Ars. If I'm not mistaken, if you go and check it, China also Ars is also there when there is a vertigo, very sudden, and walking aggravates. That covers the anxiety part also. Sir, any literature books you would recommend for practitioners? Whatever, doctor, once you have read from in your college, more than sufficient. Just the more you start reading it every day, don't mug up. Don't memorize. Just keep reading Mathematica every day. Automatically, you will understand what are your likes. See, you will attract your own tribe. Remember this sentence. You attract your own tribe. So somebody are very happy while reading Boric. Somebody are very happy while reading, in fact, Dubé Mathematica also. Somebody are very happy reading Clark or Dr. Bhanja's Mathematica. Some are very happy while reading Kent's Mathematica, Tallis Mathematica. So it always said in English that you attract your own tribe. You will attract you when you keep reading, you will find that this Mathematica I am basically finding it very easy to understand, and you can always, because all Mathematica, the basic symptoms are to be basic symptoms will be there. No, it will not change. That is more important. Dr. Ankush Malakar, she is normal. She's normal. So I think if you think that Chilodonium basically is working, you can increase the potency, or in pregnancy you can basically give prescribe Chilodonium LM potency. It would be better. Okay. So it's already 3:35, and it was a very exhaustive session today. A lot of questions asked. and keep asking the questions so that I can also refresh my knowledge of Mater Medica. I hope everybody enjoyed it as much as I enjoyed sharing knowledge with you. So thank you until next YouTube live and Instagram live. Thank you for joining.